Okay, this is Dr. Scott Geller, the eye floater expert. I could say I've done 20,000 sessions over the years. We have a great patient from Houston, Texas area. How many years ago did you have a previous floater session?
My first PVD session was about 4 or 5 years ago.
Yeah, and this was by an experienced colleague, but subsequent to that, in the right eye, you had some improvement, but you had a large mass. And did you ever have that looked at by them to see if that could be taken care of?
I did not go back to him when a periphery floater reattached in the spot where the old floater
Yeah,
was.
yeah. And I thought that would be a difficult laser object, to be perfectly honest. But, oh, by the way, it's where are we now? Mid February, almost Valentine's Day,
Yes.
2020. And you also had an issue with the left eye, correct?
Yes, I had come to rely on using my left eye because my right eye had that large floater. And then when I had a PVD in November of last year, I had no eyes to look out of. And as an editor and also an artist, I basically had to shut down. And I couldn't do anything but sit in a dark room in the back of the house.
Yeah, so actually we went ahead with your left eye. There's some stuff there, you can see it. A lot of little Highland opacities, and I got it.
You got it.
Great.
It's like having life again.
Okay.
I can read.
And the interesting thing about your right eye, aside from that a retinal wrinkle issue that you have, although your visual acuity is very good, my initial inspection showed it was very, very close to retina. I didn't really think I could get it, and I usually don't go ahead if, just to shoot a laser without having at least a good belief that the outcome is going to be positive for the patient, because we don't want people going back to their doctors elsewhere saying, well, I saw this guy, it didn't work, da-da-da-da-da-da. We want it to work all the time. Anyway, I told you, if I can't get this, didn't I say, if I can't get this, I'm not going to charge you for it? But I did get it, correct?
You got it in one session, and I just had hope. I knew it was difficult. I had no expectations. I just had hope. And you have exceeded my hope. And I woke up early just so I could look out my eyes and see again. It was so exciting to be able to look at a wall and see the whole wall instead of that huge floater sitting in my vision.
Yeah, and that floater, there was a big fibrillar mass, we call it, like an aggregation of fibers, and it tended to settle more or less dead center in your field of vision, very close to retina. But we took our chance there and
Yes.
got it,
I'm
which
so
is
grateful.
just great. And, that gives me great pleasure to do that. And you're a great patient. We'll send
Thank you.
maybe a note. Do you have an optometrist or anybody back in Texas that looked at this?
I plan on giving it to all my doctors at the clinic that I use.
Okay.
So they will all get copies of the DVD. I have one in particular who's very interested in the procedure.
Yeah.
And she will tell everybody.
Is she an optometrist or an MD?
No, she's just a regular doc. She's my doctor for 30 years.
Oh, okay.
And she's been following this process right along, and she has asked me why there aren't more people who do it. Obviously,
I can explain why very easily. There's no training courses. I went to Switzerland. I have the best Swiss laser, which you can't get anymore in this country. We have guys from Switzerland come over and service it every year to make sure. I have two of them. The other lasers that are out there just can't get everything. Guys get bad results, and that gets spread around the community, the ophthalmic community. I tried it, it didn't work, da-da-da-da-da-da. And that's the way it is. But it does work. You just have to know what you're doing and know who it will work on. That's all there is.
and you have to go to the right doctor.
Yeah,
And
of course.
I am so grateful that I found you on the internet initially, and I looked at all the videos, what I could see of the videos. And I knew that if anybody was going to take care, especially of my right eye, it would be you. I
Oh,
can't thank you enough.
that's so sweet of you. Well, have a great trip back to Texas.
Will do.
Spread the word.
I will.
Happy Valentine's Day.